Yeah.
Good evening, everyone. Thank you for being here. My name is Danielle Jerome. I'm the Associate Director for the Phyllis and Harvey Sandler School of Social Work here at Florida Atlantic University. Before we get started, I want to briefly introduce the Robin Rubin Center for Happiness and Life Enhancement. For those of you who may be joining for the first time, the Robin Rubin Center is housed within the Sandler School of Social Work, within the College of Social Work and Criminal Justice. The center offers weekly wellness programming free of charge for students, faculty, staff, friends, and family. You are all encouraged to attend our events. It's never been more important to nurture our physical, mental, emotional, and spiritual wellness. We're firm believers that it all starts with giving yourself permission to show up and step forward. So for anybody who's a first timer in the audience today, welcome. And to everyone here, thank you for showing up for yourselves today. I'd like to introduce our facilitator for today. Dr. David Wohlsifer earned his MSW at the University of Pennsylvania, his Master's of Healthcare Administration from St. Joseph's University, and his PhD in Human Sexuality from the Institute for Advanced Study of Human Sexuality in San Francisco. Dr. Wohlsifer did his postgraduate work at the University of Pennsylvania, Perelman School of Medicine Center for Cognitive Therapy, where after completion, he retained a position as a psychotherapist and clinical educator for several years. Dr. Wohlsifer is an LCSW in the state of Florida, New York, and Pennsylvania, and a Florida certified sex therapist, has over 23 years of experience in clinical practice. His areas of clinical practice include cognitive behavioral therapy, play therapy, couples and family therapy, substance abuse, and sex therapy. He has published in the areas of family and couples therapy, as well as sex therapy and multiculturally competent practice. At Florida Atlantic University, he teaches CBT, social work and human sexuality, play therapy, as well as some of the required core courses in the LCSW examination prep course. Prior to coming to Florida Atlantic University, Dr. Wohlsifer was awarded an Excellence in Teaching Award for part-time faculty from the University of Pennsylvania School of Social Work, Social Policy and Practice. He is a diplomat of the Academy of Cognitive Therapy, certified sex therapist, and member of the American Association of Sexuality Educators, Counselors, and Therapists, member of the NASW and the American Family Therapy Academy. Dr. Wohlsifer, I want to thank you so much in advance for being here. Take it away.
Thank you. Good evening, everybody. Do me a favor, say hi to me in the chat. This way we're all connected to the chat. I'm David. I see some alums. Hello, Susan Cohen out there. And I see some of our students. Welcome back. And if you can, take off your pictures because I like to relate with people. Even though I'm on Zoom, I want to feel connected with folks and as though we're working together. So give me a moment, give me a shout out in the chat, and let me know where you're sitting right now. I'm in Boca, so I have a sense. 32708, I can't see your name. Good to see you too, Susan. And I'm letting a few people in. There's a lot of people coming in through the waiting room. The weather's pretty bad, so many people are just getting home and tuning in. Hi, Regina. Hi, Everest. Hello, Natalie. So we're going to talk about sleep disorders. Palm Beach Gardens, I got you. And think about what questions you might have. This talk is aimed, it can be seen, oh, Marco Island, you might win the award from furthest away. This talk is aimed at helping people sleep better, but it's also good information for clinicians. And so I'm going to go and open my PowerPoint. And if I mess it up, forgive me, but I think I can do this. Susan, give me a nod. Can you see the PowerPoint okay? Because I can see your picture. Looks good. So thank you, Danielle and Robin and Kayla for organizing this event today. And I realize it's an old introduction because I'm out 33 years, not 23 years. So I got to up the date. Thank you, Danielle, for making, yeah, you made me younger, but it's 33 years that I've been practicing.
I'll take it.
I finished social work school in my early 20s. So let me go into my first slide. Now, how did I come to work with sleep disorders? It was unintentional. I was running a clinic for sexual abuse survivors and ritual torture survivors. So my original work was always as a trauma therapist. So I was working with people who had very severe and heavy trauma. And it shouldn't surprise any of you that all of them had sleep disorders. And I also found that for many of them, I'm going to give a trauma warning, abuse has happened to them in their beds or in their bedrooms. And so the relationship to their beds was also something that had been challenged.
Mm.
Um, so that was something that I always look at when I work with sleep disorders is what is somebody's relationship to their bed and bedroom? One woman told me once, she said, I can't sleep because when I was a little girl, I could hear my parents fighting about money in the next bedroom. And she said, now as a grown woman, when I lay down in bed, I kind of feel like I'm going to hear it again, even though I know it's over. Makes sense? So, hi, Ashley. I'll move a little further. Now, tell me if this is true or false. This is a fun sleep fact. You can go longer without food or water than you can without sleep. Tell me if you think that's true or false in the chat.
True.
It's true. Yeah, you can go without food and water longer than you can without sleep. I think it's a really important point to think about. And all of us have had the experience of having trouble sleeping. I've done a lot of insomnia work. And if you go to this website, it's my website. Let me put it here. I'll put it in the chat. Sleepcbt.com is my sleep website. Somebody once said to me, it's a curse when you can't sleep. You never get a day. You never get the chance for a day to end. I'm going to ask this quickly. Could everybody please mute their screens because I'm picking up some backfeed? Danielle, are you able to mute everybody for me? Or Kayla?
I can. Just remember to unmute yourself because it's going to mute everyone.
Oh, yeah. Oh, am I muted?
No, you're not. You're good.
I'm not muted? Okay. All right, somebody let's move us a little further here. And let me just take that one part off. Having a little trouble with my screen, so just give me one moment. So let's talk about sleep. How long can you go without it? The longest recorded time without sleep is approximately 264 hours, or over 11 consecutive days. Although it's kind of unclear how exactly long humans can survive without it, it isn't long before the effects of sleep deprivation start to show. Now look at this, because this has happened to many people. After only 3 or 4 nights without sleep, you start to hallucinate. You literally become psychotic. Prolonged sleep deprivation can lead to cognitive impairments, irritability, delusions, paranoia, and psychosis. Though dying from sleep deprivation is rare, it actually can happen. So some common sleep problems. Snoring, apnea, that's where you can't get enough air, highly likely to lead to trouble with your blood pressure, weight gain, diabetes, restless leg syndrome, where your leg is moving at night, can wake you up, can disturb a bed partner, excessive daytime sleepiness. Does that make sense to everybody? It's where you feel so sleepy, so foggy all day long that it actually kind of ruins your day. Narcolepsy, and then insomnia. So insomnia is difficulty getting to sleep or staying asleep for a long enough time to feel refreshed the next morning. How many people in the room have experienced it? We've all experienced insomnia, and it changes at different points in our life. And just here's some statistics. Among adults older than 18, this blows me away. 13.5% people reported feeling tired or exhausted most days. I think it's higher. More than a third of Americans report getting less than 7 hours of sleep in a 24-hour period. About 30% of adults have symptoms of insomnia, with 10% having insomnia that impacts their daily activities. And sleep apnea impacts 9% to 38% of the general population. I think, though, as we see more people taking the GLP-1s, Wegovy, Ozempic, and whatnot, you're going to see sleep apnea start to go down. I'm wondering if that's going to be something that starts to happen. I found this great map that shows the shortages of sleep by state. And as a state here in Florida, we're pretty high, 37.4%. So I thought that was interesting. Now, inability. Here's some examples of insomnia. The first is inability to fall asleep. And I put some patient quotes in here. Of course, they're confidential. Somebody said to me, Dr. David, no matter what happens when I lay down and go to sleep, the committee goes into session. Sometimes they break into subcommittees. How many of you can relate to that? You lay down, you think you're going to bed, and the next thing you know, you're breaking off into different thoughts and problem solving in your head, and you're not going to sleep. And there's middle night awakening. You go to bed, you fall asleep without a problem. This happens a lot with alcohol. You wake up in the middle of the night, maybe to go to the bathroom, but you can't fall back asleep for the rest of the night. One person said, I fall asleep on the couch watching TV every night with no problem. It is delightful. I sleep great during that time. After a few hours, I get up and join my wife in bed, and I can't fall back asleep for the rest of the night. I think to myself, the upcoming day is going to be ruined. I'll be tired all day long. And that thought is a really painful thought when you feel like when you know the next day is going to be really impacted by your sleep. Then there's early morning awakening. When you fall asleep, stay asleep, but wake up much earlier than you would like to, and it leaves you whole tired the next day and not feeling refreshed. I'm going to take a moment, pause. How's my pace? Am I making sense? Any questions? Just want to check in on everybody. Can everybody relate to what I'm talking about? Tell me in the chat. I kind of feel like a DJ on the radio where I can't really see my audience and connect with you the same way. So this is one of the ways that I do is through the chat. All right, so making sense to everybody. Any questions at this point? I'm going to get to how to solve this in a little bit. Any questions coming through? Anyone want to raise their hand with any questions? Okay. Let me see. I think a question just came through. Nope, we're good. We've all been there. We've all had this happen. Sleep is linked to nearly every bodily function, from how well our bodies fight infection to how well we think. So getting a good night's sleep is probably one of the most important ingredients to good health. I have this great quote here from a physician. I think of every hour of sleep as putting money into a sleep savings account. This is from the Yale Pulmonary Critical Care and Sleep Specialist. He adds, if your brain's sleep savings account is depleted or overdrawn, it will negatively affect your brain and how you interact with the world. And it's really true. Some common health problems from sleep loss, which is only less than 7 hours per night. And ask yourself, I monitor my sleep. I know how many hours I get a night. It's rare I go over 7. So sleep loss impacts cardiovascular system, endocrine system, immune system, nervous system, obesity in adults and children, diabetes and impaired glucose tolerance, cardiovascular disease and hypertension, anxiety symptoms, depressed mood, alcohol and drug use, memory impairment. Anybody want to add anything else that you know of? I'm opening up the chat. Throw it in or raise your hand. Anything else? So what causes insomnia? It's not always clear what triggers insomnia, but it's often associated with stress and anxiety, a poor sleeping environment, such as an uncomfortable bed or a bedroom that's too noisy, or too hot and cold, or too light. Lifestyle factors, jet lag, shift work, drinking alcohol or caffeine before going to bed, or eating too much before bed can also cause heartburn and sleep problems. Mental health conditions like depression, PTSD, or anxiety. With that, I'm going to also add relationship issues. I do a lot of couples therapy, and I see people avoid their beds, uncomfortable with their bed partner. Tension between the partners can cause insomnia. Physical health challenges, heart problems, other sleep disorders, long-term pain, hormonal changes, menopause or postmenopause, and certain medications, as well as recreational drugs. Now let's talk about light and technology and sleep. I purposely leave my iPhone in the other room when I go to bed because I love to look at it. I will Google ridiculous things that I don't need to know. I will Google people I went to high school with and see where they are now. I will read ridiculous stories and then make anyone else guilty or just me. I will check my email 30 times. And the next thing you know, I'll get down that rabbit hole and I'm finding out that people eat quinoa on Mars, which is not something I need to know when I'm supposed to go to sleep and I've got classes and 8 patients the next day. I want you to think of your brain when it comes to sleep like a light. It's either on or off. I was working with a teenage boy once. I'll change the story for confidentiality. And his mother kept telling him to read in bed. And I kept saying he shouldn't read in bed. It wakes your brain up. I know if I read in bed, I love the feeling of going to bed with a really good book. Can anyone else relate? And then I dream about the characters, or I can't turn my head off if it's really good. And it's not good for our sleep health. For optimal sleep hygiene, avoid technology like cell phones, computers, laptops, iPads, televisions, and reading in bed at least 30 minutes before going to bed. Now, for how many of you, just tell me in the chat, is that hard to do? How many of you use your cell phone as your alarm clock? So it's next to you in bed, so easy. I see Natalie, admitting it, right? Easy for you to pick up and start looking at. Let me see what people are putting in the chat. I use it feeling Jane, you're feeling nervous. You put there, okay. Headaches, true. Migraines especially can impact sleep. I was taught in my training program that beds are for sleeping and maybe a little bit of romance. That's not part of this talk. And they should be used for nothing else but those two things. The way they say it in sleep medicine circles is sleep and sex. That's it. Yet so many of us come home and we watch TV in our bed, we chill in bed. Now, Emma, you wrote here, my TV helps me to fall asleep, listen to rain on TV. I like to listen to storms on my Alexa. I'll say, Alexa, play storms, heavy, and I'll ask for heavy thunder. And I find it very soothing. Look, everybody has different things, but I would always advise not to watch TV. Somebody once said to me, I watch TV and then it watches me. Oh, someone wrote here they use their old-fashioned alarm clock. I think that's a great idea. So the phone doesn't have to be next to them. So I like that people are putting in solutions. Let me step a little further here. See, the first thing you should do if you have trouble sleeping, see a physician, especially somebody with expertise in sleep medicine. We're fortunate we're in an area where a lot of people are well trained in sleep medicine, because you should always get a medical evaluation first. And then I've got some resources of what we can do if we're having sleep trouble. But for me to do that, I just have to change my slides for a moment. So give me one moment to open up another website that we're going to go through. Just so I can go from the National Sleep Foundation. And then we'll go back to my other PowerPoint. Can everyone see my new slides that I have up? All right. This one's hard, but have a fixed wake-up time. Regardless of whether it's a weekday or weekend, try to wake up at the same time, since a fluctuating schedule keeps you from getting a rhythm of consistent sleep. How many of us have slept in late on a Sunday and then can't go to bed that night? And Monday's work, and we're all feeling it. Prioritize sleep. We're very quick to give up sleep, and we live in a society that actually praises it. When we talk about being busy and overwhelmed, we actually praise people. Wow, you get a lot done. It's tempting to skip sleep in order to work, study, socialize, or exercise, but it's vital to treat sleep as a priority. Try to calculate a target bedtime based on your fixed wake-up time and do your best to try to get around 8 hours a night. Make gradual adjustments. If you want to shift your sleep times, try not to do it all at once in one fell swoop, because it'll throw your schedule completely out of whack. Make small side-by-side steps of up to an hour or two until you can get adjusted. Kind of could do that with jet lag too. And don't overdo it with naps. I'm very big on cautioning people not to nap. I find when people have sleep problems, they're tired all day and it's very tempting to nap. And so the first thing they do is take a nap and it makes it worse. So if you were seeing me for a sleep disorder, one of the first things I'm going to do is ask you not to nap. Any questions about anything I put there? Let me just check the chat. Natalie, you asked about power naps. Can you undo and talk to me for a minute? Undo. Let's have a conversation about it.
Sure. So sometimes when I get really tired, I would say more towards like the middle of the afternoon, like 2 o'clock, like
that 3 o'clock slump, right?
Yes, almost every day is super tired. And then I will put like an alarm clock on my phone for like maybe 15, 25 minutes. And usually it helps me as long as when I get up, I like wash my face and then I'm already like, I don't stay sitting down. I have to move around. And then I usually
You'll
feel
wake
good.
up.
Yeah.
Two questions.
Mhm.
What are you eating for lunch?
Oh,
Typically?
it's usually not the same.
Okay, go ahead. I'm sorry, go ahead.
Oh no, I was just saying that's a good question because I don't really pay attention to that.
I have to focus in that I don't eat too carby of a lunch because I'll get that crash.
That makes sense.
So I try not to take sandwiches or things like that because I'll get breaded out.
Mm-hmm.
So think about your proteins when you're doing that. But the other thing I would tell you, if it works for you, then it's fine.
Okay.
The body that you have now might not be the body you have in 20 years. And in 20 years, things might start to feel a little different. If it's
Yeah.
working for you now at your age, then fine. If it's not broke, don't fix it. So power naps can be fine. But if you find yourself napping and unable to go to bed, that's when you have the problem. Make sense?
Yep. Thank you.
Mm-hmm. Brigida, can you do me a favor? Can you unmute and tell me what you wrote here? I'm not sure what this is.
A little jokey joke. When you get the itis after you eat a food, then you just go down.
Oh, yeah.
But you're just like,
Yeah, where you crash from it, like the sugaritis. Mm-hmm. That can happen. If I eat ice cream, and I'm hyper to begin with, I wake up hyper like SpongeBob. If I eat ice cream, I'm up all night. My legs are shaking. So follow a nightly routine. Keep things as consistent as you can. Give yourself time to wind down. You're not just going to lay down and fall asleep unless maybe you're 18 years old. Dim your lights, set a stage to feel comfortable, unplug from electronics. Try different ways to relax. Hot showers, hot baths, meditation, breathing, listen to storms, but allow yourself the transition time. This is the one that I bring home the most when I work with people. Do not toss and turn. If after 20 minutes you have not fallen asleep, get out of bed and do something. Read, stretch, watch something boring on TV. And why do I say something boring? Because then your brain will get bored and you'll fall asleep. Don't watch something interesting, it'll keep you up. Clear to everybody? So what if you notice you're not falling asleep, get up. Let me check the chat for any questions. Oh, thank you. And I'll give everybody this link. Brigitte, you said schoolwork makes you go to sleep. Interesting as one of your professors. I'm glad I can contribute to that. Take that DSM I gave you and start reading it and see what happens. Right? Read one of those articles, the kind you keep highlighting. I think it's very important that we all get daylight exposure. We're lucky we live in a place that allows for that, but there's always that time of the year where we finish working at 5 and we leave our parking lots and it's dark. And I think it's important that we have daylight exposure. I was on campus today and I was talking to somebody over who works in the Barry K Auditorium. And she said to me, I didn't realize it was raining. I have no windows in my office. And I thought that must be awful, especially in the winter, because she can't see the weather or see the light. Try to be physically active. It doesn't mean you have to be an Olympian. It might mean you walk around the block. Don't smoke. Nicotine is a stimulant. And try to reduce alcohol and caffeine. And try not to eat too late, which is really hard for me to say because I like to eat dinner around 9 or 10. My family's from Argentina. That's when we tend to eat. But it does impact us. Let me take a moment. I'm going to put this link in the chat for people so you all have it. And then I'll go back to my other PowerPoint so you can take a look at that. Let me just check the chat and see if there's any questions. Oh, Olga, unmute and connect with me and talk to me. And then Alan, join in afterwards.
Hi, Dr. David.
Hi, Olga. Good to see you.
Good to see you too. So sometimes it's the eyes that need a nap, actually, not necessarily the brains. When the eyes are too tired from the of the light and everything that's going on. So sometimes, like I need to fall asleep for a nap, just for the eyes to get rest.
It's what you need. The question I would ask you is, how is it working for your overall sleep? Can you sleep at night though? When you go to bed?
So I actually don't have like problem to fall asleep at night, but the nap has to be short.
So there's your know yourself. All of our bodies are different. And where you are at in life now may be different than where you are in 10 or 15 years, right?
Oh, that's right.
In terms of life and body changes, school. You have 3 little kids at home now, right?
Yes.
That's really different than when they're all teenagers, right?
Yes.
So you might need 10 minutes just to zone out psychologically.
Correct.
So if your eyes need it, if it's not impacting your sleep, it's not a problem. But if it is, then that'd be something I would take away. Make sense?
Yes, totally.
Thank you. Alan, why don't you unmute and ask your question? Do I see Alan? And let me hit up what Alan asked. Is exercise good before sleep? I don't think just before, because it keys you up, especially, we get our heart rates up and then it takes it down. I mean, know your body, but I would say give yourself at least a good 30 minutes after exercise before you try to go to sleep, would be my advice. Here's some other techniques that I put in here that may help you a little bit. Keep a sleep diary. And a lot of times people have different devices now. I forgot what there's one that, what's the ring that everybody wears now that records your sleep? Anybody know? A lot of my patients wear them. The Fitbit does it, and you can wear the ring that records your sleep, but try to monitor your sleep. The more we're aware of something, the more we can take care of it. So try to monitor your sleep. Keep a sleep journal. Be aware of your sleep complaints and what's bothering you. Look for stimulus control and sleep restriction. Go to bed only when you're tired. Keep this in mind. If you're having trouble sleeping, try to limit your activities in bed to sleep and sex. Get up at the same time every morning. And if sleep doesn't occur within 10 minutes, go into another room, which I mentioned. And there's the paradoxical intention. Here we ask patients to stay awake when they get to bed. The idea is that the paradox, the opposite, will reduce your anxiety and help you fall asleep. So if you can't fall asleep, simply try to stay awake and see how that goes. Actually, it may have an opposite effect. There is always what we call CBTI, and there are many ways to find CBTI trained therapists. You can always just call me and I'll find you one, because chances are many of you are in my personal life and I can't be your therapist. But cognitive behavioral therapy for insomnia, there are cognitive interventions where we try to restructure people's inaccurate or helpful thoughts about sleep. Behavioral interventions where we intervene with some of the things I talked about, like sleep restriction, compression, incorporating relaxation. I recommend weighted blankets a lot. Even though we're in Florida, I find weighted blankets really soothing as a behavioral intervention. And then psychosocial interventions, providing information about thoughts, feelings, behaviors, and sleep is central to CBTI. And I think I'm hitting all my major points I had. So what I'm going to do is I'm going to turn this off. I'd love to have a conversation with you about sleep.
You have some questions in the chat.
Oh, cool. Yeah. Let's look.
I have a question, Dr. David.
Hi.
Hi. So I ordered these like yellow, I guess, blue blocking glasses, these yellow glasses. And I try to put them on like every night, like at least an hour before I'm going to go to bed. And I watch television with them, actually. You kind of get
You
used
try to decrease the blue light.
And I'm going to tell you something. I think I'm sleeping better.
That's awesome.
How do you feel about that?
I think it's great.
Yeah.
Look, how do we know, look, you as a clinician yourself, as a trained social worker, if somebody feels better, we've done our job, right?
Yeah. Yeah.
If a depressed person tells you I'm not depressed, an anxious person tells you I'm not anxious, a couple tells you the relationship is better. And if you're sleeping better, then I think you should put in the chat where you got them from so other people can buy them.
Okay. Amazon. Okay.
I'm there every day. I bought a tablecloth today with Neil
Yes.
for induction. So I think they're great. I mean, look, we know, where can you get training for CPTI? I did mine at the Center for Cognitive Therapy at the University of Pennsylvania. But Cindy, if you Google right now CPTI training, I guarantee you'll find it. And if you, Cindy, do you have my email? I'll put it here. Email me offline and I'll help you. Susan, go ahead.
Hi, Dr. David. Nice to see you.
Nice to see you too.
Thank you.
And another fellow Philadelphian.
So my question is about our clients who utilize sleep medications for sleep, like trazodone. And some of my clients even talk about how it makes them so groggy during the night that they're at risk of falling. So how do you respond to that?
So what I often do, I'm a PhD, not an MD. I always say I've got to stay on the function of my license, but I call their physicians or their nurse practitioners and try to help them. I mean, especially if they're older, you're talking about somebody who's at a high risk for a fall.
Yeah.
Because A, they're sleep deprived, B, they're over medicated, and their bodies aren't probably processing it, and that's where you're likely to get a fall. I mean, what population are you talking?
Yeah, I would say, 60s to 80s.
Mm-hmm.
Yeah.
very likely to have falls there. So I think it's really important because we know that often as we age, our sleep quality does go down. One of the things I will tell you that I have found when I've worked with geriatric population, I also look at what the role of loss, and often in my case, I've seen widowhood, how that's impacted sleep. Because imagine, I got sad to say this. I remember my father-in-law said to me, he said, I was 7 years older than my wife. And I'm a man. I always thought I would outlive my wife. And he would tell me that every night he would pat the side where my mother-in-law slept because he outlived her.
Mm-hmm.
And going to bed for him was a loss trigger. He hated it because it reminded him that his wife was gone. And so another thing, when you're working with people clinically, ask them, what does it mean to go to bed now in your life? Does my example make sense?
No, it definitely does. I mean,
Yeah.
my question around this is, do we try to encourage these other alternative solutions, especially when some of them are falling?
Always ask the physician before you pull away a medication if they would support you and partner with them, and say, why don't I document that I called, Dr. Rubenstein, and together we are partnering to reduce your medicine. I'm going to reduce the pills and increase the skills. That's what I would write in my chart. Reduce pills, increase skills. Working collaboratively with physicians. So you do have the physician oversight around the medication. So nobody withdraws or something. You know what I mean? Am I hitting your question?
Yeah, no, of course, I would never encourage them to
No.
stop taking the medication, but but to speak with their physician.
And you speak with the physician.
Yeah, it's a good
do
idea.
a collaborative call. I like to do that, and I think it's good for liability that we have documentation that we did. Sound good? Let me hit up some of the other things here. So Ashley, I will get around 7 hours of sleep, but kind of struggle with getting out of bed in the morning. I set 2 alarms. Ashley, you've probably begun to give yourself permission to let 2 alarms go by. So the 2 alarms aren't helping you because I'm going to guarantee you. Tell me, Ashley, unmute with me. I'm going to guess. Tell me if I'm right or wrong. That you say, oh, the first alarm went off. I don't have to get up because the second alarm is coming.
A little bit, like my mind wakes up at least, but it's like I'll have racing thoughts for a moment, but I do rely on that second alarm.
You know what I would have you do?
Mm-hmm.
Go to 1 alarm because you're giving too much permission around the second alarm.
Okay.
Because then you'll say, oh, that's just my one. No, I got to go. I'm going to be in trouble the rest of the day. Try it.
Yeah, because like I used to do 1 alarm, but then I branched to 2. But yeah, someone else said that they struggle with feeling rested despite the hours they get, and I relate to that. So I'm
That's
not sure
where
what to do different.
I would tell you first talk to a sleep physician about why.
Okay.
Go see a pulmonologist who specializes in sleep and get an evaluation. Make sure there's nothing going on, that you don't have apnea or restless leg or something else. And then maybe then you can find the psychological solutions. Does that hit your question?
For me, yeah.
Okay.
There's
And nice to
another
see you here.
question, Dr. Wohlsifer, that I don't think you saw from Samantha Walk. She said, personally, I
Yep.
get 8+ hours of sleep and have no trouble falling or staying asleep, but I never wake up well rested. I consistently feel tired in the morning, usually throughout the day. Is there a solution? I just want to know, is it the amount of hours? 8+ sounds like a lot.
Could be, but Samantha, I'd get a medical evaluation to rule out apnea. Because a lot of times we think we're sleeping well. Listen, I have sleep apnea. I got it. I probably weighed at the time 140 pounds. I'm 5'10". I was very thin at the time. I had nothing blocking. It's the shape of my mouth. When I was a little boy and I would go to sleepovers, the boys would throw me under the room for snoring. And then one day I drove into a pole. I dozed off and kind of drove into a pole and didn't get hurt. But I realized something was going on. I was always tired. And I was having probably like 30 episodes of apnea per hour. And both my siblings have it. It's the shape of our mouths. So I would get a medical evaluation, see what's going on. And if that shows nothing, then again, like I said to the other person, actually approach it psychologically. I hope that helps. Let me look here. Any other questions? Well, I hope this talk helps you sleep better. Just wanted to throw a few things out there for folks. And I put my email address at FAU. If I can help people with resources, just email me and I'll send them to you. Oh, 6278 says, I love all your suggestions. I would add calming bedtime yoga. That helps me. Sometimes getting out of your head helps. Absolutely. Getting out of your head and into your body. I also drink herbal teas every night, but there's a problem to that because they make you get up to go to the bathroom. So, but I fall back asleep. But tea can be a diuretic. Robin, if there's no other questions, oh, thank you everybody for your nice comments. I'll turn it over to you.
Okay, give me 1 second. Oh, 1 second. I think I'm up.
Take your time.
I think I'm maybe on. Oh, I'm not on mute. It's funny because I think that technology also has, unfortunately, like last night I was laying in bed and I was thinking about something I had to do and I realized, oh my God, I have Alexa. Alexa, put it in my calendar, Oh, she's talking to me.
She just activated
Oh
her.
God, she's talking to me now. Okay. All right. Anyway, yeah, never
You
mind.
have an issue too.
Work
and here's another issue. You work in your bedroom.
I know that is a problem. I know.
And I guarantee, have you ever gotten out of bed and walked over to work on something?
Duh. Of course. Of course. But last night when I realized that I could actually tell Alexa to put something on my calendar or put something in my Amazon cart, that's like a whole new thing now. That's like a whole new reason to but at least it's kind of like, because I think sometimes it's good to keep like a piece of pen and paper next to your bed so that you write something down that you forget. Yeah.
But then you have to compartmentalize it.
Yeah, exactly.
Somebody just wrote me, Natalie, please do me a favor and give your mother a big hug for me. Of course I know who she is.
Will do. She was excited when I told her that I was going to be part of your class today.
So please give her a big hug for me.
Will do.
Does anybody have any other questions? Otherwise, we're going to drop a link in the chat. Did you do that already, Kayla? Drop the link in the chat. There's a little. What? Yes?
Yes.
Okay. Any other questions before we wrap it up?
I'm glad people enjoyed.
David, thank you so much for all of your suggestions. I love them. And thank you for being with us. And hopefully it encourages us to recharge our wellness with healthy sleep hygiene. It's like more important than sometimes we give it credit for. And to everyone that's been in the audience, thank you for spending a part of your evening with us. I hope you will join us again in the next academic year. We will have a lot of new programming. You can register on our website, fau.edu/happiness. And while you're there, remember to register for our next event, which is the New Year's Wellness Series. Have a great rest of your evening and be well. But I don't think that's our next event. That's incorrect.
No, it is. It is incorrect. Our next event will be in August. You're right.
That is incorrect. That is incorrect copy. Sorry, take that back right now. I just want you to, be in contact with us and register for our next event, which will probably be in September, where I will do something related to positive psychology.